if I'm a cardiologist treating heart disease or I'm treating cancer, I'm adding 2, 3, 4, 5 years to someone's life by treating them. What you're talking about is exponentially larger than that, potentially.
That's right. Yeah. And again, we can put numbers on this. So you're right. At the individual level, obviously it depends on when you get cancer, right? But at the individual level, the gain in life expectancy can actually be pretty big. If we cure somebody's colon cancer when they're 50, they may go on to live to be 80 years old, right? So that's a big chunk for that person. At the population level, though, those numbers are actually pretty small. So demographers have done the math, and it turns out if we could cure every form of cancer, I had a magic pill. I'll give it to you. You take this pill, you will never get cancer. A typical 50-year-old woman gets 3 years of life expectancy across the population. Same thing for heart disease. If we do both, it's about 7 years. And that's because when we treat individual diseases in isolation, all of those other age related diseases, kidney disease, liver disease, dementia, loss of immune function, those continue to increase exponentially. And so something else is going to get you. Whereas if we can target aging and slow aging, you get a much greater proportional increase in life expectancy, with the added value that those extra years are going to be spent mostly in good health, because we haven't only fixed one thing, we've fixed everything that goes wrong with aging, at least in principle. That's conceptually the rationale for putting more resources into targeting aging, keeping people healthy, than what we have done historically, which is to put our resources into waiting until people get sick and treat sick people. And I do want to add, I'm all for treating sick people, right? I'm not saying we shouldn't try to cure cancer. My mom had colon cancer during COVID, and I am grateful every day that we were able to cure her cancer. I wasn't involved in it, obviously, but her doctors were able to cure her cancer. So again, it's really important. We always want to have what I call reactive disease care. We always want to have the hospital systems that can take care of people when they get sick. What I think I'm advocating for, and you as well, is that it would be much better if we could keep people from getting sick for a longer period of time. And there are ways to do that. We have the tools to do that today.